The arrival of a baby is one of the biggest changes in a couple's life. After childbirth, many questions may arise about the care a newborn needs. In this video from AllForBabies, we will see what the first days of a baby are like and what they need. What the first days of a newborn are like. During the first days, it is common for the baby to sleep almost 24 hours a day and to lose some weight compared to their birth weight, which they will gradually regain as they feed. It is important to offer feeding on demand until they regain all the lost weight. Afterward, feeding will be entirely on demand. Next, we will see what care a baby needs during these first days. Feeding. The best feeding a baby can receive is exclusive breastfeeding. During the first days of life, the baby is satisfied with their mother's colostrum. If you choose formula milk, it should also be entirely on demand and exclusive for at least the first 6 months of age. Hygiene. A newborn baby does not need to bathe daily. In fact, it can be counterproductive. Short baths on alternate days will suffice. The most important thing is to keep the diaper area clean and dry to avoid irritations that may cause discomfort. Additionally, it is important to file or trim the baby's nails to prevent scratching. Diapering. It is crucial to change the baby's diaper every time it is soiled to prevent skin irritation. It is preferable to do so with water and soap or a gentle cleansing lotion, avoiding the use of wipes as they can promote redness. Dressing. During the first weeks of life, babies have difficulty regulating their body temperature on their own, so they will need an extra layer of clothing. This means that one more layer than what adults wear will be sufficient. We should not overdress them, as it increases the chances of sudden infant death syndrome. Umbilical cord. The umbilical cord takes a few days to fall off, and specific care is essential to prevent infections. The most important thing is to keep it dry at all times and cover it with a gauze to prevent it from rubbing against the diaper. Once a day, it can be cleaned with saline solution, 70% alcohol, or chlorhexidine. Sleep. Babies are not born knowing the day and night schedules, so their sleep hours are regulated based on hunger and satiety at any given time. This means they will sleep for 2 or 3 hours and wake up to eat regardless of whether it is day or night. We should lay them down on their back with their head turned to one side, alternating the side of the head each time to prevent plagiocephaly. Additionally, co-sleeping on separate mattresses is very beneficial. Visitors. Another piece of advice for the first days of a baby at home is to limit visitors. It is normal for many people to want to meet the baby, but it is not recommended. It is important to avoid having the newborn pass from one person to another, as they need peace and gradual adjustment to the world around them. Pediatric checkups. These checkups are essential to monitor the baby's development and address any questions that may arise during the first days. Daily walk. It is important for the baby to go for a daily walk to get fresh air and natural light, avoiding direct sun exposure. In summer, the hottest hours should be avoided, and in winter, the coldest ones. Crying. Crying is the baby's first form of communication, and with it, they express all their needs. It will become one of the most common sounds in the house. It is essential to respond to their call as soon as possible and provide them with everything they need at each moment. See you in the next AllForBabies video.